I would like to introduce our panel here, who are going to be sitting alongside Ian and Atifa. First of all, Lindsay Bain, if Lindsay would like to come and join us over here. And Lindsay is an alumna of the Young Diplomats of Canada and is also living with a permanent psychological disability, CPTSD, if I'm right, anxiety and depression, and is working in social policy, doing a master's in public policy, and more in a moment. Next guest is Geraldine Dressler. Please join us. The COO of the Trellis Society, working with children, youth and families to unearth their potential and support their growth, and was Executive Director for well over a decade with the Distress Centre Calgary, a crisis support helpline and counselling service. So brilliant insights, I'm sure, to share. Patricia Jones. It's great everybody's over there, by the way. President and CEO of the Calgary Homeless Foundation, and has a background in social work with a clinical speciality. And, of course, you're going to be still joining us, Afiba. And last guest is Kimberly Tateson-Bennett. Who is Director of Health Services, CUPS Calgary, AB, is that the right way to say it? Who joined community health and the non-profit sector a year ago after a 25-year nursing career, specialising in acute care. And health, of course, and mental health isn't just about mental ill health. At 4 o'clock this morning, I was not sleeping. It's jet lag, hey? Just flown in. And then I thought of the mountains here that surround us, and I suddenly was able to let go. So I just was thinking in my mind, as I was thinking that Sophie had just told me last night that I'll be chairing this morning potentially, and I thought, isn't it wonderful that we're here? So I'd like to invite you all to rotate your chairs, and we can put up the blinds for a moment before we begin our discussion, just to have a moment to look at the mountains. So if you'd rotate your chairs, pivot your chairs. Because there is strong evidence that being or watching blue and green spaces, natural spaces, rivers and mountains, strongly correlates with improved well-being. And I'd like to invite you for a moment to consider that these Rockies that we're seeing have been forged by converging tectonic plates millions of years ago and formed from rocks, some of them over 1 billion years old. And these Rockies are still being formed and shaped as we're watching them in front of our eyes. So I'd like you for a moment to invite you to focus on the light that's shifting in this landscape, the details, the clouds, the waving leaves in the trees in the foreground. And you can expand your awareness from being located inside your body to this more spacious awareness, to take in this whole expanse. It's both still and it's moving, a calm, still moving. And you might choose to think of your lifetime, which is only a moment in the lifetime of these mountains, these rocks, this landscape, which we learnt from Karen yesterday from a First Nation perspective, is part of us too. And this space of natural beauty in Banff, in the Rockies, and the warm community that you have all formed here together is a space for you always to draw on and return to. And if you can bear it, I'd now invite you to turn around your chair. So we've got a quick poll, but the good news is you're going to get a chance to stretch your legs because you might not be near in order to play on your phone. So the question, first of all, here, and to reflect on some of the data that you were sharing with us, who has had direct experience of mental health issues? So you want to start, if you can't get close enough to a screen, please take the opportunity to go for a miniature walk.
Smart.
How would you define direct?
That's a very good question. I think we'll let people define it themselves, but that's something we could talk about. Because I'm then going to ask people who has had a close family or friend who's experienced mental health issues. So the first question is you yourself. Now, it would be great if I could see the data in front of me too, if that's possible. Or else I'll go for a little walk.
I can show you here.
Oh, you've got it there. Yeah, so 72%. So we're even more than your data suggests. And the second question is, who has had a close family or friends who's experienced mental health issues? I can't see that, but don't worry, because I've got a bit of help. Yeah, and that's 95% at the moment we're showing. 95%. So we're not talking about somebody else, are we, here? We're talking about all of us. And I'm also really grateful, actually, for your honesty. I mean, it's obviously anonymous, but also honesty to yourself about what you've experienced. And I think at some level, that testament is a part of the space of truth that we have created here together in Banff at this summit with What Works. So I'm really delighted on this panel to have such an extraordinary range of expertise. But I'm also aware of the expertise in the room. And this is a town hall, which is different from a panel, in that we are going to hear from you guys, but then we're going to go to the floor and hear not just your question, but also your insights. So I'm going to just go to each of you in turn and perhaps just quickly remind us who you are, is to say to you, from each one of you, what do you think is most important in the framing you think that you need to have in order to think of the best, most effective way to systematically tackle mental health challenges? So I'm looking for the framing that you think is most important to systematically tackle mental health challenges. So can I start from you and give it a quick intro?
My goodness. So my name is Kim Tateson, and Director of Health at CUPS, which is a community health center in Calgary, one of 2 in the city and one of 3 in the entire province. So thank you for this opportunity. That was a good question. I think maybe what I think is most important is our ability to demonstrate the work we do with our vulnerable populations and socially vulnerable populations, to demonstrate and tell a story about the services that we are providing. Utilizing those stories both from our data that we're collecting as well as client-specific stories about their journeys, if you will, and highlighting their truth and taking that to a larger stage, both internally and with our community partners and with the funders that we work with.
So is the storytelling based on individual stories and communicating that to the most important people, the stakeholders, is that right?
Absolutely.
Brilliant.
That's a good answer. I'm Patricia Jones with the Calgary Homeless Foundation. We are also a purpose-led organization, so we are around to guide the fight against homelessness. And I guess the frame I would offer is one that ATB does, which is access to mental health. So I often say somebody who's experiencing homelessness doesn't access or utilize mental health like you or I might. Many of you will have EAP programs where you'll make the call, you'll get your appointment, you'll go for your 50 minutes, you'll come back. Somebody who doesn't have a home, who has extensive mental health issues, doesn't actually have a computer, that's not how they access mental health. So I think the framing is how we access, how we ensure we're client-centered, so the people we serve actually are in the driver's seat about how they access mental health is critical.
Brilliant. So it's access as the frame which you think we need to use when we're looking at systemic mental health solutions.
Yes.
Is that right? Brilliant.
So I'm Geraldine Dressler. I use she, her pronouns, and I'm currently with Trellis Society, previously with Distress Center Calgary. And when I think about mental health and what we need, I think back to when we expanded our services at Distress Center from phone to include chat and text. And it was one of those very memorable conversations. I'm sure we all who work in the mental health space have those. A youth was sitting across from their parents at dinner and texting us that they were having thoughts of suicide. So what I think about is I think about the need for greater access, certainly. Greater access is important, but I also think, now that I'm at Trellis Society and seeing the power of community and the power of someone next to you understanding who you are and what you're going through, that can't be underestimated. And 95% of us in this room have experience with someone having a serious mental health concern. So how can we better equip ourselves and the people around us to be able to respond? And I think your session the other day about deep listening was really powerful. And I think that's a key piece of it.
So it's about acknowledging the role of community and resourcing community, which is there, present, to support people who are struggling with mental health. Is that right?
That's right, yeah, because we're more connected technologically than ever, but in many ways, we're more disconnected than ever. So it's really about that connection and having a human connection with someone who listens. If not entirely understands, listens.
Attempts to understand.
That's right.
Brilliant, thank you.
Bonjour, my name's Lindsay Bain. I am an alum of Young Diplomats of Canada. I'm bringing kind of an interdisciplinary range of experiences to the panel. I am just graduating with my undergraduate degree from the University of Manitoba in global political economy, and I'm starting my master's in public policy at U of T in September. I also overcame an addiction to alcohol before starting university and have utilized services in different domains, whether university involvement or externally in the community, different nonprofit organizations. And one thing, I'm also a member of Wabigoon Lake Ojibwe Nation, and my work in social policies as the Abenouji Naknegewan Youth Advocate, so working to implement our child welfare law, taking back autonomy over child welfare to First Nations control. I think we really need to completely restructure and reframe how we conceptualize mental health in general. There's a lot of systemic reform that needs to happen, but mental health is a completely holistic thing. You need proper housing, as homelessness was mentioned. You need addiction services if that's an issue. You can't necessarily even access addictions issues or services unless you have a house and feel safe. And then you're able to get to a place where you can address the underlying trauma issues or work through counseling. But even as is, current service provision is based on crisis response or very short-term service provision. Otherwise, you're paying out of pocket. And even as a university student with coverage through health services, you get $600 for mental health coverage, which at $200 an hour does not go very far. So yeah, we need holistic supports and longitudinal supports, and one-size-fits-all applications are not going to fix it. So that's my take.
Thank you so much. So it's systemic and it's holistic. And thank you for sharing that with us, because, you know, being vulnerable in front of all of us is obviously fantastic, because it allows all of us to acknowledge our own vulnerability, and is obviously a source of enormous strength and power, both to yourself and to everybody who you've decided to share with today. So thank you so, so much for that. And Lindsay, is there anything you'd like to add from all your insights that you were sharing this morning? Sorry, not Lindsay. Ativa, sorry.
That's all right. I would, not just because I'm an economist, but I would go back to the data. I would agree with what Lindsay had said about that holistic approach, but I think also data becomes crucial when it comes to influencing stakeholders, especially the policymakers. If 95% of us in this room are saying that we or someone in our family has experienced a mental health issue, are we influencing our stakeholders, our policymakers, in a way that they will implement policies accordingly and allocate resources, not just policies, right? Because right now, mental health is really not, it's under-resourced. So if we can influence the policymakers and change makers and stakeholders to allocate the proper funding to it, then I think that would resolve some of the issues that Lindsay mentioned about whether it's housing or income support, so it becomes a holistic approach.
Yeah, thank you very, very much, Afiba. Thank you for that. So I want to turn to the floor now, unusually because this is a town hall, and I know there's a lot of expertise. And just to kick us off, I'm aware of some specific expertise. So if I can turn first to Joanne Smithson, who I was having a chat with this morning at the back. And I know, your work and your expertise is about a different frame of mental health. And you, of course, work with What Works. So perhaps could you just explain what you do and help us understand this different other frame?
Thank you. Yeah, so I'm Joanne Smithson, and I'm with the What Works Centre for Wellbeing in the UK. And I think our framing really takes mental health to be a spectrum. At one end, we have mental ill health, we have diagnosis, but that moves through a spectrum towards perhaps anxiety, uncertainty, but then moves towards a place where we're able to feel in control and that we can influence the things that are important to us, where we can use our skills and knowledge, where we can flourish as individuals, where we're feeling good and functioning well. And I think it's so important in this discussion, absolutely, that we have the support services that those that need it. But we mustn't forget the role that we all have in creating mental well-being as well. And if I think about what matters to us as individuals in terms of our well-being, it's our health. That's the primary driver, our physical and mental health. But then beyond that, it's our relationships. It's those connections we have. It's the connections we have, our close personal relationships. It's our relationships at work as well that are huge drivers of our well-being and how we're doing. And the third biggest driver of our individual well-being is the things that we do. So our jobs, our work, having a good job, a good quality job, that goes beyond having a fair salary, that allows us to use our skills and knowledge, to have autonomy in the role, and to feel that the workplace is fair. So I think for me that framing that really recognises both sides of well-being, the mental ill health and mental well-being, is particularly important. And I think just to finish and conclude on the data, it's absolutely, we've got to get better at understanding who's using our services, the effectiveness of the services, and who isn't able to access. But equally, I think we need to understand in more granular detail how we're doing as individuals. So in the UK, we have 4 measures, Office of National Statistics, 4 measures of personal well-being. And I'd maybe just invite you to think yourselves as I go through this on a scale from 0 to 10, where 0 is not at all and 10 is completely. How satisfied are you with your life nowadays? How happy were you yesterday? How anxious were you yesterday? And to what extent do you feel that the things that you do in your life are worthwhile? And that last one is particularly important because it's absolutely no coincidence that the flip of of the extent to which we feel that things we do in our life have meaning is the flip of the suicide curve as well. So that's the frame that we use in our work and What Works. Thank you. Thank
you so much, Anna. Lots of really interesting things for us personally as well as professionally to think about there and meaning and how important that is. And I think perhaps, all gathering here together and having a few days in, one of the most beautiful parts of our universe in which we're located in, and having a chance to think about those meaningful choices we're making as individuals and professionals allows us to come back to our day jobs more invigorated about what we do and more conscious and, making more conscious, aware choices in order to lead a more meaningful life. Mm-hmm. Thank you for that. Next thought, Kieran, who's sitting almost next to you, Kieran Boyle, and your work leading the Guy and St Thomas's Foundation. I know you're doing a lot of thinking about the reframe of health and mental health as assets, which draws upon some comments already that we've been hearing.
Yeah. Well, I'll pick up on the point on assets in just a little bit, but I mean a real yes and to everything you said there. Perhaps I can just talk about 2 particular things that relate to health inequalities as relates to mental health that we see in our work. So firstly, there are lots of big employers in the room. Lots of big employers are now providing really good support to their employees around their mental health. Well, kind of, because it turns out to be not all of their employees. So often we see that for better paid staff, there's really good mental health support, but actually as you start looking at, for example, outsourced workers or cleaners or receptionists, shift workers, that support really drops off. And as we go back to the data, you really see that's where some of the health inequalities are starkest. Second thing that we see is that, of course, mental health is not in isolation. And if you look at the pattern of people developing multiple long-term conditions, which the health services are often where it gets really expensive. You know, it might be somebody has a number of health conditions at the same time. Typically, it will be a mental health illness that will be the first condition that presents. So, for example, something like depression. And actually, those are the points where you really need to intervene, because if somebody has depression, they're much more likely, for example, to develop diabetes or COPD. And so we actually, I think, need to look at mental health in the roundness through our healthcare systems as well. So just two perspectives from a health inequalities perspective.
And you were going to say something around reframing.
Well, I'm going to talk about that because I'm on net, so
I see. Apologies.
I'll save the killer lines for
Okay.
then.
No, sorry. I didn't realise that. Thank you very much for that. Erin Dixon, Reconciliation Canada. I want to hear about your perspective from your experience working across Indigenous communities in the whole of Canada in terms of mental health.
Yeah, thank you for the opportunity. And I'll just start from a personal perspective. I just turned 44, so when I was 22, I was actually hospitalized and diagnosed with something that my grandmother was diagnosed with. And so I would start with, in the spirit of reframing, all I heard when I was there is they're telling you what they know, but not what is true. They're telling you what they know, but not what is true. And so foundationally, as a young person, without even realizing I was praying for not only truth, but to heal naturally. And so it takes you to interesting places. And I would say the one thing that I would encourage is actually the foundational theory in which we come to understand mental wellness. And how, in the dynamic, I would say proportion as you brought us into of our intelligence as human beings, that the mental health in which we try to fit into can actually contain us instead of liberate us. And so I think that's one thing that I've worked with. Like, I was just at the Canadian Association of Suicide Prevention Conference in Montreal, and a couple of beautiful things to lift up, working with young people across Canada, Indigenous youth, asking, what do young people need right now for mental well-being? And in their framework or their continuum, they created connection to self, the who am I, the connection to land, where do I come from, the connection to community, which is embedded with kinship systems that are beyond family, is embedded with culture that emerges through the land and through generations. And then they also looked at the connection to spirituality, which is both individual and collective. And so they created workshops, free workshops. And so there's a beautiful website, wisepractices.ca. And I think I would share that because that's communities telling their own stories of not only individually, but mentally how they've come forward into well-being, especially, thank you for the statistics in the beginning, but because of the colonial pressures and the fact that we still have reservation systems. So that is also a system of oppression that sits inside of our mind. And I remember Elder Tom Cranebeer at the BAM Center, we were in a circle and he was banging on the chair and he said, you have to think outside of the table. You know, you're sitting at this, and we say that all the time, but I would also encourage that. So there's the First Peoples Wellness Circle and the Thunderbird Partnership Foundation. They have a First Nations mental wellness continuum framework. And I would also ask, you know, it's interesting to ask nations how they would like to be surveyed on their well-being. Which angle are we looking at? And when they asked communities, how would you measure your well-being or your mental health, they looked at measures of hope, meaning, belonging, and purpose, instead of the other diagnostic, because there's a movement towards life promotion and understanding the multi-dimensions of how we are each brought into creation to promote life and therefore well-being for all of creation, post-industrial models. So I think there's so much intelligence that we have to bring from both internally and externally. So I think that's, from a personal perspective, but also being able to listen to the stories. And we have so much diagnoses around things and different systems interacting, that also to slow down, like COVID, what I heard during COVID was a slow down period to care for our intergenerational trauma. It had to do with our lungs. And so the lungs of our planet, the lungs of our people, to know what time we're in is vital for the mental well-being of our future. So I would also say we're seeing a lot of trauma-informed responses in Kenora, in Treaty 3 territory. They have a collective community trauma-informed response. That's massive for mental well-being in nations, because many remote areas that you have to reach to get to are then dislocated into areas that they're sent out to. So it's so multidimensional. So I would say that looking at it from that, I think we're talking about systems interacting. Mental well-being is very, very important, but even the foundational concepts in which we come to know, I think, is also a really important time to revisit. So thank you for giving me the chance to share with everyone. There's such beautiful work being done everywhere by people.
Thank you so much. And it's obviously so important being here now for us all to acknowledge the trauma of that community and of so many other communities that people are grappling with. And what a beautiful framing of hope, meaning, belonging, and purpose in terms of the positive mental health frame for everybody. Before going back to my panel, I'm wondering if there are other people who I haven't selected who feel they have an important contribution that they want to make here. There's a lady with a light blue jacket here.
Thank you. I am not a frontline worker. I do not have the fortitude to do the work that all of you do. But I am a fundraiser, and my job is to fundraise for mental health and addictions across the entire province. I haven't been at this very long, but I do have some observations. First is, it is for every dollar you invest in mental health care, you save up to $10 to $17, depending on the study you look at, in upstream healthcare costs. So when you look at the GDP, imagine the impact on our GDP of the cost of mental health care. Also, the thing I'm learning more and more from people who do work on the front line is that we need to meet people where they are at whatever stage they're at in their illness or their recovery. And that means doing so without judgment. This cannot continue to be a political issue. Whether your beliefs are right-wing or left-wing does not in any way help those that are seeking supports, whether they are young, whether they are old, or whether they have addictions. When we talk about removing the stigma, we need to get serious. I recently had the opportunity to do a TV interview, and one of the things that I support is a key mental health care facility in Edmonton. And having done work with hospitals before, I said, you can meet me out there at Alberta Hospital. And they said, well, we're not allowed out there, the TV cameras. And I said, oh yeah, you are, we're going. And so then I had to phone Alberta Healthcare and say, we're going out there to do an interview. And they said, oh my God, you can't go out there. You can't have cameras out there. And it's like, if I can have them in a children's hospital, I can have them there. If we're gonna remove this stigma, we have to get a little bit more bold about doing it. And I think finally, where it is political is we have to look at where our social services supports actually do more to create mental health challenges and keep people from recovery. I had a phone call yesterday from an individual who's looking for income support, suffering from mental health and physical health, and the amount of money received for this month emergency funding is $800. I don't know how you pay rent and buy groceries, never mind seek mental health care support or a bus pass on $800. It's not possible, and we're too quiet about that stuff. And I think the other thing is that we all have to be vulnerable. Like a few of us has shared this morning. My mother, my parents, my family went to alcoholic treatment centers like some Albertans plan trips to Arizona in the wintertime. My mother died at 33, an alcoholic, and taken pain medication. There is bipolar disorder, schizophrenia, and all kinds of stuff up the family tree. My grandfather was a survivor of the residential school system because that was the only place to send your kids to school in northern British Columbia at that time. When fate said you have to raise money for mental health and addictions and put me right in front of that same alcoholic treatment center in my car, it says that sometimes you have to actually dig in where it's uncomfortable. And so those are the things I've learned so far. And I look forward to learning more from all of you and supporting the work that you do.
Thank you. Thank you so much for sharing. And how wonderful for your family to know on some level the work that you are doing to grapple with some of the issues that they were having to work with and live with. It's very, very powerful. Thank you. Thank you very much. Other thoughts in the room? Lady just next to you in the white jacket.
Thank you. Thank you so much, and thank you for folks who have shared. I'll start with a little bit of a story because I started my career in the nonprofit sector, and as part of that, particularly in sexual violence, and as part of that, because in the nonprofit world you do everything, I did some frontline work, and there was this moment that really solidified for me the need to have conversations of intersectionality and representation. And I was in a hospital holding the hand of a young Indigenous sister who had experienced recent violence. And I share this story with permission. And she held my hand so tightly, and she said, "I'm so grateful that you're here because everything, the walls, the nurse, the doctor, the police officer, are all white. And I don't think they see me." And so for the folks who do work in frontline and have leadership for services provided, we know that the mental health model and the social work model have roots in some pretty interesting saviorism complexes. How do we continue to assure representation, equity, and, to Erin's point, consultation and collaboration with communities who are most often intersectionally represented at the margins, but not often represented in service provision?
Thank you very, very much. A really important something for all of us to think about. Thank you for that. Any other thoughts? Otherwise, I'll turn to my panel. I don't know if there's anything that there was so much here. I feel that we could have kind of a whole summit on this subject and so much wealth of expertise and thought-provoking statements and questions and ideas. Is there anything that any of you want to pick up that you've heard, that you've learnt from the floor here that's made you think differently in any way? Provoked you to want to do more or do things differently?
You know, I think the word that comes up for me when I listen, thank you, Roselle, for that, is the term inclusivity. And I would agree. One of the reasons, before I came to Calgary Homeless, I was with a counseling agency for 27 years. So that is what I did for a living. And one of the reasons I wanted to come to Calgary Homeless is the systems change that needs to happen. And that the way that sometimes we treat people in our sector, and I represent the sector as well, is not how you would be okay to be treated. And in terms of exclusivity, and the CEO of Drop-In Center is over there, and she loves it when I point her out, and the CEO of the Alex, is they would say they have those roles in those organizations, but people who are experiencing homelessness and are vulnerable is all of our issue. It is not just their job. It is all of our issue. And if somebody's feeling excluded or not being representative or on the street, and I work with somebody experiencing homelessness who said he doesn't even feel like he deserves the sidewalk. And during the pandemic, when people were so afraid, he wasn't allowed to go into a Tim Hortons to warm up his hands because they were afraid of him. That as a community, and you can tell I get really passionate about this, we have to be bold. We have to be bold and say, it is not okay how we treat the people we treat. And you would not be okay with being treated that way. You just wouldn't. So I do think we need transformative system change, and places like ATB are at the lead of that in terms of access to mental health. So that's what comes up for me.
Thank you. Thank you very much. You're nodding there.
Yeah, for sure. I think that point of intersectionality is so critical, and I think we need to look at not only being anti-oppressive, anti-racist, working from a trauma-informed lens within our organizations, we also need to challenge the systems that were built on colonialism. And we need to break down silos. I've heard that in multiple sessions over the past couple of days. Break down those silos, because this really does require all of us to not only use our voice, but pass the mic. That, to me, was really critical. pass the mic to folks who might not have the opportunity to speak up. So I love that you're here, Lindsay. I think lived experience is so important. We really do need to pass that mic and empower others while also doing our own very important work of looking at ourselves and the systems that we work within and how they are perpetuating decades, centuries of oppression.
Lindsay, any thoughts from you listening to all these experiences and testimony from the room?
Yeah, I was just gonna add on to similar logics, but not just passing the mic to people that may not share their voice so often, but also to community level ideas for alternative interventions or alternative service provision. Lots of times it's decision makers in suits making decisions on what community needs for addiction services or how many counselors are needed, when at a community level, yes, you may want a counselor, but you want someone who is versed, for First Nations as an example, in traditional knowledge, who's going to integrate land-based knowledge with traditional Western medicine or psychological approaches with elders and sharing circles and attending sweat lodges. Another thing that came up that can be done from a business or admin level that I heard recently was not only paying for mental health days off, but especially for Indigenous people, allowing mental health days to attend ceremony, or just upping the number of mental health days so that you have time to not only take care of burnout when it happens, but also to go to community and spend time on the land, because that is mental wellness holistically.
That's a beautiful point. I'm sure we would all like to do that, but especially people who have that particular attachment and for whom the meaning is so apparent and so important to their lives. A sort of positive mental health day. That's really beautiful. Any thoughts from you?
I would just echo what Lindsay said, and that also goes back to what Professor Wong mentioned earlier about when you're designing things is it from the perspective of the end users? Is it their proposed solution? Is it appropriate? And when Lindsay's talking about culturally appropriate mental health model. So I think that's something that I'm certainly not an expert in this area, but I think of even my own mental health needs, and what has been effective for me is, to Rozelle's point, you want to see yourself. Like if I have go to a therapist, I want to see myself in my therapist, right? It makes a difference. It doesn't mean that somebody else, a different therapist, could not provide valuable support. Certainly they can, but there are certain nuances that culturally appropriate therapist, for lack of a better word, would have that would be really key to my mental health well-being. So just to echo your points, Lynn.
That's really
I just would like to add that we are trying to incorporate people with living and lived experience into everything we do at our organization, and I know across the community, and using the voices of people that know, that have experienced, and can bring that information back to myself and others within the team to help organize and operationalize what we do and how we do it. And I think that, thank you for bringing that up, because it's just something that we're really starting to get into doing.
How are you doing that?
So we do it particularly, we do it in the health clinic. We do it...
in what way? It'd just be interesting so people might not know.
Right, so we have a COVID vaccine team with a peer support worker who engages clients within our health clinic, as well as doing some outreach work with our housing programs and our child development center to educate individuals when they're interested in learning more about the vaccine. But just engaging in those conversations, very natural. And I will say that our peer support worker with our vaccine team was instrumental in getting us probably 75% of individuals vaccinated in our community from the vaccinations that we did. We're also using peer support workers in our liver clinic, and that is a seek and treat program that we have that goes out into the community and finds clients that were lost to follow-up or interested in Hep C testing and treatment, so engaging people where they're at. This particular individual has lived experience. She has recovered from Hep C and has that knowledge and is able to have conversations with individuals where they're at to talk about her own experiences and start those trusting relationships. Trust is a very big thing in our community, as we know. So peer support workers are those people that we rely on to bring that expertise to what we do.
It's so interesting, isn't it, peer support? I remember a decade or more, Mothers to Mothers working really effectively in South Africa with women who are HIV positive, so that the women who are helping tell them the news and offering them support and ways to deal and manage their condition are women who themselves have been dealing with HIV, and that's so powerful. Well, I think it's just a phenomenal degree of insights and things shared here, and I'll just pick a few things that I was sort of scribbling down because there felt like there were so many. The role of data, but also what questions are being asked when we gather that data and how important that is. The social determinants of health. Greater confidence in talking about mental health following COVID and how healthy that is for all of us. Because I think whenever we're dealing with something and somebody else is speaking publicly, there's a little bit of us that feels healed. And the more of us who can have the confidence to talk about this stuff, the better it is for everybody and for ourselves. The importance of workplaces and employers, and thinking about all employees, not just the select few who are on the best conditions and get that mental health support. The systemic questions around housing, intersectionality, and understanding that there are so many different roles that we play in communities that we belong to and how they can intersect, which becomes so important in understanding and also treating mental health conditions. Oops. And being able to think about mental health as a canary in a coal mine for a whole host of other health conditions and how useful that can be. The importance about being vulnerable and sharing and how powerful that is together. And who's doing the designing? That's come up very clear from a number of people. Who's doing the designing of interventions? How can we pass the mic, not just for voices, but also the community-led intervention ideas? For example, like a positive mental health day for people particularly who have particular needs, for example, being close to the land, particularly those who don't feel represented. And the need to be bold when we're dealing with mental health issues, because they are so important to so much else in all our lives. And the importance of community and each other and how much we can all do as individuals to support people who are in our very small community, but also even, I would argue, with strangers, people who we don't know. I was just reading some research yesterday from a group in the UK, an email, and that bus drivers' mental health was really positively impacted when one of their customers just said, "Hi, hello, how are you?" Just the very small little interventions that I can see some nodding there from Joanna, that we can all do in our lives and the people that we encounter. And then just to tie up with the connection to self, to land, to community, to culture and spirituality, and of course, hope. So thank you very much, everybody, and thank you for a brilliant panel, and thank you, everybody, for taking part and sharing today. I'm very grateful. Thank you.